Thanks so much for joining me today. We're going to talk a little bit about Chiari and syringomyelia and how it affects brain development.
Sure. So I'm Jarod Roland. I'm a pediatric neurosurgeon here at Washington University in St. Louis. And I, of course, take care of the full gamut of pediatric neurosurgery. And when I'm not doing that for my day job, I'm doing research with functional imaging or intracranial electrophysiology, and specifically here, doing that with patients with Chiari malformation.
Kind of go back and redefine Chiari and understand how it affects brain function, development, and how patients do, right?
It's an interesting one because it's specifically a structural abnormality that we don't fully understand why it causes the symptoms that it causes.
So take us through it a little bit. How do you actually perform this and map the cerebellum? What does it look like to a patient, for example?
I'm talking about mapping specifically with resting state functional imaging, functional MRI. There's a lot of different ways you can talk about mapping. There's a lot of different type of connectivity metrics you can use. Here we focus on resting state functional MRI. There's a variety of reasons for that. There's a significant advantage to being able to tell a patient, I don't need to put you through a lot of tasks. I don't need to have you do a lot of complex calculations in an MRI scanner. All I need you to do is sit pretty still as you possibly can, keep your eyes open, and try not to fall asleep. That's the task.
Sort of on that, so you have this advanced MRI scan that looks just like any other MRI scan, but patients are sitting in there, and while they're resting, awake, eyes open, their brain is sort of being mapped, not in real time, but when you come back and analyze it over time, right?
That's right.
Tell us a little bit about how you're relating that to function, meaning how a patient's doing, if they have symptoms, if they're how their brain's developing, and then maybe related to that, if somebody does have a Chiari malformation, what kind of information can this scan give you about how their symptoms may or may not relate to that Chiari?
Yeah. So I think that's the crux of the question for this research. And there's a couple of different ways of going about it, a couple of different ways that we're going about it. One is we have some a priori information about these various networks. Sometimes we'll use the term canonical networks, resting state networks that have been previously described, previously correlated to other types of functions. So one common example that was some of the early work was done here, pioneered here, is called the default mode network. There's a few other networks like the frontal-parietal network. Some of these have to do with things like attention or executive function, and the strength of the connectivity and the organization of those networks might be altered in people who have dysfunction in some of those type of higher order cognitive abilities. That was certainly some of the things that we've seen in Chiari malformation is occasionally there are these type of complaints that we didn't understand very well how they relate to the cerebellum. And our hypothesis is that some of the network level organization might be altered in patients with Chiari malformation compared to others. Getting other type of cognitive testing to see if we can hash out, quantify some of those complaints, some of those concerns, maybe some of those cognitive deficits, and use those as a correlate to the functional connectivity to hopefully tie those two in a more quantitative, more robust manner. The goal, of course, is if we can do that, if we can correlate those things and have a stronger signal straight from imaging, not have to put someone through all that cognitive testing, hopefully it'll help us tie that relationship of what's causing those cognitive symptoms and be able to predict who will benefit from intervention better than what we have today.
You know, when we talk about ranges like that, one thing that I know you and I have talked about is, do we try to study individuals with severe Chiaris or mild Chiaris, or, how do we try to understand the disease by studying just one end or the other?
Yeah, that is a tough one too. But it's also one of the more interesting parts of the project, that if we only ever studied the people with severe Chiari, then what value are we actually adding, right? If we only study the people who we know need treatment, we're probably not actually changing anything. So I think it's even more interesting to study some of those people at the other end of that spectrum, especially some of those patients that we hear about so often who present to us with what imaging suggests might be a mild Chiari malformation because their tonsillar ectopia maybe isn't so severe, but their symptoms might be severe. And it's very interesting that there's the other side of that coin is we have patients who have significant tonsillar ectopia well beyond any kind of widely accepted cutoffs for what would define a Chiari malformation, that just by imaging looks severe, but their symptoms are mild. sometimes even completely asymptomatic. And how you kind of rectify that kind of cognitive dissonance is tough, but that's what we're hoping we're going to find in our functional connectivity data, is that if those patients who are more affected have significant changes in that connectivity, that might be a better metric than something simply structural.
It's interesting, what we're really getting at is kind of the nature of this project, which is, are we really just talking about the degree of tonsillar ectopia, the cerebellum protruding into the top part of the cervical canal? Is it as simple as that? And I think we both agree, probably not. So to just have a sort of one measure, tonsillar ectopia, and to say severe or mild, probably doesn't make a lot of sense. A person who's in the audience here with us right now is Gabe Haller, who's done a lot of work on looking at the development of this condition. And at least in some individuals, it's not just related to compression of the cerebellar tonsils. It may even, in some individuals, be more widespread, this condition. About your technique with resting state is you can sort of appreciate not just what's happening at the level of the cerebellum, but how it's affecting the rest of the brain.
I think that's exactly right. That's the part that gets me excited about it the most, is this funny little structure. These cerebellar tonsils have these huge implications. And like you said, it's probably something that goes well beyond what we can just see on a routine structural MRI. And that's the great thing about this combined project, is that while my focus is on this functional imaging, it's going to all go into a larger group that we're all studying slightly different things. I don't understand anything about what Gabe Haller does. Gabe Haller probably knows a little bit more about what I do, but in the end, we're going to put all of our data together along with all the other projects and hopefully redefine what Chiari is.
Talking to the fourth project in the group, where we're starting to use machine learning to cluster how people present and their symptoms. Part of that work is being done by Sean Gupta, who's also here. And what we're seeing is the patterns are not all occipital headaches, or neck pain. We're seeing some people present with spinal deformity or, any number of other symptoms. I think that what we've always been taught is that Chiari is headaches, occipital back of the head, worse with a cough, and really brief. But certainly it seems more complicated than that. And I think maybe some of your studies are going to give us some insight into that.
But of course, I'm a surgeon, so I always want to be able to tell you I can help you. But more than that, I want to make sure that I'm not going to hurt you. And so being able to identify which patients can benefit from the surgical procedures I do is a challenge. And I want to be able to help people. A lot of times what we do in clinic are telling people that you're not the right person for surgery. You're not a candidate. And this is something we worry about a little bit with Chiari malformation, is there's probably some patients out there who probably could be helped, but because they didn't fit into a very narrow definition of what we currently think of Chiari malformation, we might be missing out on helping some people that might benefit, that we just don't recognize.
And just to say it a little bit differently, if we can use resting state functional networks to understand the far-reaching implications of Chiari, then I think we'll have done some good, which is essentially looking at brain network-wide effects of Chiari malformation, which is one of the 4 key areas that we're using through this program project grant. The others are certainly synergistic with that, right? Whether it's the developmental aspect that Dr. Haller is working on, or is it other imaging tools that we're using with Dr. Straley and Dr. Song, for example, looking at really specific quantitative flow abnormalities, looking at strain and movement of the tissues, looking at micro histological changes in the brainstem, in the cerebellum, even as it stretches up into the rest of the brain, spinal cord. And then, of course, the last bit that we talked about is trying to put all these things together using advanced technologies to help us to understand this disease and how it affects brain development to a more certain level, and also to understand how, when, or why to treat. And so ultimately that's the goal. But I thank you. Your part is obviously a really, really critical part of that.